Hi there, this is Dr. Evan Osar with the Institute for Integrative Health and Fitness Education. Welcome to this edition of Facebook Live. We're here talking about this week in this two-part series about the knee, a very simple assessment you can do with your clients that have common knee issues, and a very simple corrective exercise and fundamental movement pattern progression for your clients with knee issues. Now, a very simple assessment you can do with your clients is just watching them in single leg stance. Now, it's not the only assessment you'll do with your clients because you want to see how your client loads up as they bend their knee. You also want to check some of the flexibility, range of motion, mobility around the hip, knee, ankle, and foot complex as well. But a very simple thing we do with our clients is just have them stand with their feet facing straight forward. So parallel facing straight forward, just very simply look at their kneecaps. Are their kneecaps basically in a straight line with their feet? Oftentimes, if the feet are straight, what you'll see is on the side of knee problems, the patella starts to rotate in. So the kneecap faces more, the patella faces more this direction versus straight that direction in line with the foot. And that's a common sign that your client is probably doing some rotation through their knee that's increasing some of the stress and pressure on their knee. From there, now we watch what they do when they load up because we never base anything alone on the assessment. So we just have them simply stand on one leg. And what should happen is when you stand on one leg is that the individual is able to stand fairly straight and with control. They're able to align their thoracopelvic cylinder over top their foot tripod, and the hip, knee, ankle, and foot stay relatively aligned, meaning the patella, the kneecap, should stay facing straight forward towards the camera as I think it's doing here on my right side. Then have them do the other side, especially the side, have them do their good side or their more controlled side first, and then the opposite side, so their more challenging side or the problem that has knee issues. And then watch that patella and watch the reaction on that side. Generally speaking, on the side they have more challenges with, especially around the knee, they'll shift more to get their weight on that side. They'll start to rotate their leg or their pelvis, and you'll see the kneecap start to rotate that direction even further. So they won't align it where the kneecap, again, is in between the hip and that big toe and second toe. So that's a common sign that your clients are starting to rotate, increase the rotation around their knee. So what we want to do is start to look at some of the structures, those myofascial structures that actually pull the knee into that position. Now, of course, we're going to assess the thoracopelvic cylinder up here first. We're going to assess the foot and ankle complex as well. But around the knee specifically, what tends to happen is the client is overusing their biceps femoris and their lateral gastroc, and that compresses the knee laterally, hence the reason you start to see that knee rotate that direction. Now we're going to focus just on the knee and release that area. So you're going to release the biceps femoris, the lateral gastroc, so do your myofascial release around there. But then it's also important how you have your clients stretch their hamstrings, because a lot of our clients are simply just doing stretches like this, where they just put their leg up here and they just do a random stretch like this, and they may even go over like this. But the challenge is our clients don't need more length in their medial hamstrings, so the semitendinosus and membranosus. They need more stretch in the lateral hamstrings, and that's what they're not stretching. So here's a very simple way that you can have your clients stretch their lateral hamstrings or the biceps femoris. Have them sit, place their hands upon their pelvis, bring that leg straight out in front of them. What they're going to do is basically turn that foot in slightly and keep that leg pretty much right in line with their pelvis. From here, they're going to do an anterior pelvic tilt, so that way they feel a stretch in their hamstrings, but what will really be getting stretched and lengthened is that lateral hamstrings, because most of our clients are stretching their hamstrings like this and not keeping the leg here and bringing that pelvis to align with that leg, so they actually get lengthening through the lateral hamstring more so than the medial hamstring. So they'll basically just hold this position and then release back out of it. From the side, it basically looks like this. Leg out, rotate towards that forward leg, that straight leg, and then hinge forward. So you're basically doing a seated hip hinge to lengthen that lateral hamstring, to make sure that you're balancing out that medial and lateral hamstring to create more optimal alignment of that femur over top of the tibia relative to the hip and ankle and foot complex. So this is Dr. Evan Osar with the Institute for Integrative Health and Fitness Education, showing you a very simple assessment and demonstrating a very simple corrective exercise strategy we use once we've done our assessment and our soft tissue release. From here, now we'll take our client into a fundamental or functional movement pattern to help integrate proper alignment of the hip, knee, ankle, and foot complex. I'll come back later this week and share that with you. Make it a great day, and we'll see you next time on Facebook Live.